we're having a really wonderful conversation today about something that's really hard. And I'm going to admit, I'm totally nervous. I've been nervous for the past few days, knowing that we were going to do this recording. I am joined by two of my favorite people, Dr. Natalie Pearson, who is a psychologist who works with people experiencing racial trauma. She's also my dear, dear high school friend, the person that I would cut school with, and we'd go and study when we would cut school. Remember that? So we've had a long history together, and this is a conversation that we never had when we were experiencing the things we were experiencing in high school as a result of the racial makeup of our school. And I'm also joined by Katie Sloan, who's also a dear, dear friend. I can share with you that she's a patient of mine who has actually helped me tremendously in learning to become a better teacher, to be more inclusive, to learn how to teach people about self-care. She is an incredible human. And they are going to help me talk about something that's been on my mind for a long time. We are going to be talking about the concept of privilege, whether you have it or you don't have it, or you have it in some places and not others. We're going to talk about that feeling of being the other that I'm sure all of us have experienced on one level or another. We're also going to talk about systems of oppression and how that creates stress in each of us as individuals, whether or not we have privilege or not. And we're also going to talk about white supremacy culture, which is a term that actually makes me feel really stressed out because it's something we've all experienced on some level, but it's never been really acknowledged. And I almost want to be like, can I even say that term? Right. So we're going to kind of unpack a lot of these. And the reason we're doing this is because stress that is as a result of racial trauma, racial stress impacts the immune system. And if we're really truly trying to be holistic about managing our health, trying to have less inflammation, less autoimmunity, less symptoms, we got to call out these elephants in the room that are now becoming easier to talk about because we're being given words to describe the systems and the feelings and the results of these structures in place. So we are all about the root cause. And one of the root causes of stress on the immune system is that stress that we experience sort of under the surface all the time. We're going to be sharing personal stories. We're going to be talking about new concepts, new terms. This is going to be a conversation where we are being vulnerable, we're being courageous. We're actually saying things that maybe we haven't said to other people before. And we feel it's really important actually to share this with others because we think that you will have some aha moments as we're going through this conversation. So I also want to acknowledge that most of our audience is white, but there are people of color as well. And we want to talk about how this impacts everybody. So this information is really for you, whether you are white, Black, or of a different color. We want you to start paying attention to how each of us three may reflect what you might be thinking and how the voice of one of us tends to resonate most with you and why that might be. Autoimmunity impacts each of us uniquely, but so does racial trauma and racial stress. So today, there's going to be three perspectives, that of a Black person, an immigrant, and a white person. So I want you to stay in the conversation. We're here to learn from each other. We're here to build compassion and empathy and to figure our way forward in this really complex world that hopefully is moving to a better place as we start having these brave conversations.
Wonderful.
And let me maybe just start by introducing myself for those that don't know me. I'm actually going to start with a land acknowledgement, which actually is a new concept to me, but it's so important. I'm joining you from the ancestral lands of the Ohlone, the Ramaytush, and the Muwekma tribes. And I'm an uninvited guest on their lands, and I want to acknowledge their sovereign rights to this land that I'm on. And I want to actually pay my respects to their communities, past and present. I'm also an immigrant. I was not born here, and I'm the daughter of two immigrants whose roots are from Iran and Armenia. And we left due to war, religious persecution, in search for a better life. And reaching the United States was like a major milestone because this is a place where people think of there being an opportunity to grow and to acquire a different life and to be safe. And so I'm so proud of living in the United States and being a part of this amazing culture, which by no means is perfect, but it is my home and a place that I've actually gained a lot of privilege in. I'm also a physician. I'm triple boarded in anesthesia, hospice and palliative medicine, as well as integrative medicine. I also practice functional medicine and acupuncture. And so I've been very lucky to have a very broad lens in how to look at health, disease, and how to make people feel better. And I've got here with me Dr. Natalie Pearson, who is going to tell us about herself.
Well, first of all, thank you so much, Dr. Payrovi, for inviting me here to be able to talk to your audience about racial trauma and about radical self-care and how we could heal from racial trauma. Like you said, my name is Dr. Natalie Pearson. And so the introduction that you just talked about, Dr. Payrovi, is something that's kind of new, and we call it decolonized introductions, right? And so it's where we bring forth all the things that are informing us, right? And so for me, I am coming from Ohlone land as well, here in Oakland, California. I'm also the daughter of basically two folks. My dad is from Birmingham, Alabama. My mom is from Mississippi, Morton, Mississippi, a little town outside of Jackson, has dirt roads. Used to have dirt roads till I was 16. And they were part of the first, well, actually, the last part of the Great Migration. We talk about the Great Migration from when we were emancipated from the South to the North, South, the North, the East, and the West. And so they came to California in the 70s. I am also, a sister to someone who has a mental health disorder. I'm a single Black mom. I am, a doctoral, I have a doctorate in education. So I have, graduate school, first person in my family to earn a doctorate. And so I'm coming forth with all of these different parts of myself. Also a fur mom too. So all of these things come together to create who I am. I've been practicing, let's see, I've been practicing since 2004. So I have over 20 years experience working with people around anxiety and depression. But I feel like my life's work has been around racial trauma and racial oppression. It's really the reason why I went to graduate school, is to kind of get the formal tools, to work with people, work with Black and Indigenous people of color, BIPOC, around healing the wounds of racial oppression.
Beautiful. Thank you for sharing that. And Katie Sloan, tell us about you.
Sure. First of all, thank you for including me in this really important conversation today. I'm excited to be here to share my perspective, and I hope that that's helpful for listeners. I was raised on Ohlone land. My family has been in Ohlone land for 4 generations. I am German, Italian, a lot of other stuff. And I want to acknowledge that half of my lineage I don't know because one of my parents was adopted. And so there is a lot of my cultural makeup that I don't actually know, but I certainly present as white. And that's my position here today, is that of a white ally. Now I actually live on the land of the Selenian people, which has always been referred to in their language. I don't know the equivalent, but the Springs, which was known as a place of rest and rejuvenation, which is perfect because I'm also here today as someone who lives with a health-related disability. So I can kind of talk about that, and we can address ableism and some other things that are related to today's topic. I'm an educator with a passion for DEI, diversity, equity, and inclusion. I've worked in public schools and other schools for over 30 years. So I've seen how some of the things we're going to talk about today have really negatively impacted the educational system and the children of today. I also am a host of a MS Health podcast, and I also coach people in mental fitness. And one of the things I didn't anticipate about becoming a coach in that program was how much it would explore different aspects of my identity and how that plays into my current beliefs about myself, others, and life experiences. So I'm just really happy to be here and be included in this conversation. And I look forward to diving in and all of us being brave as we come together around this difficult topic.
Yeah. I just wanted to jump in and say something that, like, I realized as I was talking about, you know, all the different parts of myself that I didn't name. I named that my parents came from Mississippi and from Alabama, but I didn't name that we are, our ancestry is of enslaved Africans, which is really interesting that I didn't mention that because that's a major reason, why my work is so grounded in racial oppression and racial trauma. But yeah, I thought I'd bring that up. And I'm just sitting with that. I'm like, why did I say enslaved Africans? It's really hard. Just maybe this is the thing around what you were talking about, Dr. Payrovi, like is saying the word white supremacy, right? Um, it's charged with a lot of thoughts, a lot of images. I think we talked about before, like that being, when we think of white supremacy, we think of, maybe skinheads or Nazis, and not so much as the ways that white supremacist theories and ideologies are interwoven into our system. And I think when I think about like saying enslaved Africans, although I'm very, very, very proud of, my ancestry, it's actually part of when we get to the other part where we talk about radical self-care, what has really, really like helped me move through my racial trauma. Still, there's something about just saying enslaved that's vastly different than being an immigrant or coming here, um, from different means. It's a very different experience in this country, which we're going to talk about today.
I actually think about that a lot, Natalie. Your ancestors came here unwillingly,
Mm,
whereas my parents wanted more than anything to be here. So we came under very different circumstances. And yes, we still experience racial trauma, but I think the roots of it are different. We have different expectations.
yeah.
So since this is really your wheelhouse, Dr. Pearson, explain to us, what is racial trauma? What is
Mm,
racial stress? Because I remember having a conversation with you when there was all the upheaval a few years ago. And it was the first time that I thought, you're allowed to be stressed because of racial factors. Like, I actually didn't realize that that was a thing. You were the first person who actually taught me that. So, can you explain to us what is racial trauma, racial stress?
yeah, yeah. It's really funny because I have a hidden view, so I can't see my face. So I'm sure when you said that we are allowed to be stressed, I'm like, right, my eyes, boop. Um, yeah. Well, first of all, like there's like an allowance, right? And I don't know if it's an allowance or if it just is, right? It definitely is, just has always been for me and I'll say from um my people, right? And racial trauma, let's just break it down like to like, a quick and dirty like definition of it is that it's a trauma that is like a beautiful nexus of acute, chronic, and intergenerational trauma. And it's comprised of emotional and psychological residue from the constant exposure to ever present race related chronic stress. That is definitely a quote from Dr. Kenneth Hardy's book, Racial Trauma, and Clinical Strategies and Techniques for Healing Invisible Wounds of Racial Oppression. So we say invisible because people don't really see what we are dealing with, and so much to the point where I think and I say we, Black folks, might not even know that what we're experiencing is racial trauma. And it is an experience that is, when I look at what is PTSD in our diagnostic statistical manual, which is, the psychologist like Bible on diagnosing, it's all of those symptoms, but in a way that is, well, I think it's manifested in accordance to race. So I can tell you the symptoms of PTSD, right? The symptoms of post-traumatic stress disorder is that you've been exposed to a deeply disturbing event, right? And that exposure has you feeling like, your life has been threatened. It's either a perceived, threat or an actual threat, right? And then, of course, there's sexual violence. There's all sorts of things that constitute as trauma, but that something has happened, right? And within that, we have a certain set of symptoms, which is lack of concentration, depression, feelings of hopelessness, avoidance of the trauma, of the triggers, um, hypervigilance, which means hyperarousal. You're kind of like on edge, a fragmented sense of self, which we also use a really fancy word called depersonalization. It's hard for you to be in your body, right? There's disassociation, which is another big fancy term for, that it's likened to intense daydreaming to the point where you've lost time, space, you're not here, right? Your body, your mind, your psyche has kicked in to help protect you from the horrific things that you're going through. But what that results in is like you feeling like you're not here, right? Another set of symptoms is intrusive thoughts, memories, um, uh, anxiety, and a sense of foreshortened future. So with racial trauma, what that looks like is a lack of concentration, is you're distracted by the perceptions. I'm just going to give you some examples, right? Um, Distracted by the possible perceptions from others about who you are. You're so preoccupied with that it interrupts your ability to be present and stay focused. Um, the depression, the feelings of hopelessness about your future, about your safety, your sense of safety in the world, avoidance of trauma triggers, avoidance of situations that may expose you to racial oppression. Um, that fragmented sense of self looks like for racial trauma, confusion of one's identity or sense of belonging. Where do I belong? If
Right.
I'm not accepted by main society, and because we have such internalized racism, I might not be accepted within my own ethnicity due to colorism or
Mhm.
so many things, right? And so that's like this lack of a sense of belonging. Where do I belong? Disassociation. Remember, I said about like, it's like a big denial, right? So much so that it has taken on like a whole nother life of its own, and it's a protective measure, right? But with racial trauma, we find that it's like a collective denial, one, that racism is even happening, but
Mhm.
on an individual level, doubt of one's own experience. Like, did I just experience that? Did they just say that?
Mhm.
Did, you know, what? So many times when I have people in my practice, there's a lot of around like, I don't even know if I can talk about this because I don't even know if that's considered racism. And it's like, you have to question, it's definitely considered racism, right? Um,
It's so amorphous.
mhm,
Like it's hard to pin it down. You know it's there.
mhm,
You feel it. Your gut tells you it's there, but you don't, it's hard to have like proof, right? And to say, until you go to someone like you and you're like, here are the symptoms I'm describing. Like you can ask a patient that, and you're like, as you were going through the list, I was like, yep, 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 all of that.
Yeah.
For
Yeah.
myself.
And the fact that you feel like you have to prove, right? So that's a part of racial oppression, that the dominant society, that the white supremacist, um, you know, view is that like the power to define for other people. So the fact that I'm saying, well, no, it is racist because blah, 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 blah. I need to like point out and prove. But it's like if you're experiencing something where somebody is saying something derogatory, or maybe they're meaning it in a really nice way, but it still hits you, and it's based on race, it's based on something around your ethnicity, there is no question about it. That's just what it is. It's a form of racism. We're all really scared of this word, right? But I think the only way that we're going to be able to heal from this collectively, right, is that we start acknowledging what is and start being okay with feeling uncomfortable. Like, oops, I made a mistake. Okay. Well, like, I have more respect if we could admit that we made a mistake and then work towards that together. Okay, and then I'll go through these last three, like, symptoms. So we said hypervigilance, hyperarousal, hyper aware of one's ethnicities at all times. I'm always aware that I'm Black. It is just what it is, right, for me. Like to the point where I vacation, I don't just think, oh, I'm gonna go on vacation. I think about where I'm going to be accepted, what is going to be a great experience for me. Will I have experiences of discrimination? And that's not a vacation for me, right? So that's just an example that I'm always aware of my ethnicity, even when I walk into a room, when I walk into the store, when I'm driving, I think about it for my son, and how he's perceived. And so we're also hyper aware of racial inequities, prejudice, discrimination, anxiety, living with a generalized state of race-based anxiety and suspicion. It is a constant awareness to the point where it just makes you uneasy a lot of the times. Sense of foreshortened future. Sometimes for folks, they're thinking about that like, oh, my life, that I'm going to die, sooner than others, which is very,
Mhm.
very real for me as a Black person and very real for my son, who's a Black man, right? An itty bitty Black man, 13, but at 5'7", I'm aware that he's perceived as a Black man. And so I'm worried about his future. I'm worried
And
about how he might be.
that's backed up by data. That's not you making something up in your head.
No,
Yeah.
no, no. And so, but it's also feelings of hopelessness about like jobs and like, finding a partner, right? Because our future, what keeps us, stable and so forth is financial stability as well. So all of that comes into play. So all of these are like a beautiful little nexus of what racial trauma is, but then it could also be passed down intergenerationally, right? Like how I move through the world is definitely informed by what my parents told me. So I have distinct memories of before going to kindergarten, my parents talking to me because, we grew up in a Silicon Valley, and I was always one, maybe two Black people, in my class. But my parents gave me a talk and they were like, when you go to school, you're different. And people might ask you about your skin tone. They might ask you about this. And I was like, oh, okay. All right. It was like, so things are passed down in that way. And also things are passed down behaviorally, and it's coming from a place of, well, one, protective measures, but there could be some ways in which the trauma gets passed down too. But what I love to tell people when I work with them is that not only is like, we get stuck in the muck of like, oh my gosh, I'm just moving to this world as a traumatized person. Yes, but also resiliency is also passed down to us.
That's a really good point.
Yeah.
We
Yeah.
can choose what we pass down.
We can choose. Sometimes we can, sometimes we can't, right? Because it's on an unconscious level, around why I would be harsher with my child as a protective measure, like, so that he doesn't get the brunt of society, right? You know, um,
But also being intentional about
yeah,
building resilience
now
into
that is
what
absolutely,
you're showing your kids. I think it's really important. Yeah.
absolutely. Mhm. Mhm.
So, Katie, can you tell us about your experience?
Sure. I'm just so grateful to Dr. Pearson for sharing all of the descriptors of like PTSD. And, as someone who looks like me, I will never know what it's like to walk in different skin. But I hope that people who look like me are thinking about the ways that maybe they have felt other, because there are ways that then we can lean into empathy and really better understand what racial trauma could be like. And so, there are some things that I've experienced in my life that I think have helped me to become a stronger ally over time. And I want to be really clear that that's something that is in a constant state of evolution. Every day I learn and grow more. So this isn't, this isn't something that like all of a sudden you understand, right? It's something that we learn over time. And I never thought that I grew up with trauma, but after my MS diagnosis and a full neuropsych evaluation, it really opened my eyes. And I've been through PTSD therapy as a result of that. And I was raised as a relative have not in a very wealthy place, and I think I was just made to be really aware of these differences or these feelings of other. I also experienced being bullied at home and at school. And so, I have some understanding of what it feels to not be accepted for who you are. And so I would just today, when we talk about this, I just want to encourage people who look like me to find those places in your own life where you have felt other, and then lean into those feelings, because I think that's how we can better understand and better support and better work towards change for people who don't look like us.
Mhm. Mhm. Yeah, I think, Katie, you and I have had, well, all three of us have had conversations, but in the work that you do, right, with, diversity, equity, and inclusion, like sometimes, and this has also been my experience, to have, you know, non like BIPOC, non-Black folks, right, understand what the experience of racial oppression might look like is to bring up another form of oppression or otherness, right? I'm just double down on what you just said, right? And sometimes for folks, it could be starting with sexism, right? And what that feels like. And you can't remove, like being a woman or being perceived as a woman and what goes along with that. And racial oppression is very similar, right? I can't remove my skin. I cannot, especially for me as a dark skinned Black woman, which is another layer, right? We have stratifications within this system of racial oppression. And so when I said colorism before, it's like there is that white supremacist overview, right? That if you're, this was, something that we say in my community, if you're white, you're right. If you're brown, stick around. If you're Black, get back, right? And so here we have that stratification. And so some folks might be white passing and have some privilege, And I think, Dr. Payrovi, when you talk about being, an immigrant, but not having, people don't know that about you until like, you tell them, right? And so you might be perceived as like white passing. And so
Yeah.
all of these different stratifications. Yeah.
Yeah. And, just to speak to the immigrant experience, coming here as a 7 or 8-year-old child, facing difficulties with like the language barrier. I learned English within 6 months, but it took my parents much longer. So, being cut off from kind of like the mainstream society because of language, because of financial issues, right? We had a really hard time here trying to figure out work that was going to provide steady income. Also, just difficulty assimilating. Of course, I assimilated much faster than my parents. I'd say they never assimilated. And always like being aware of how we are so different at home. What we eat is different. How we greet each other is different. How we interact with our elders and our relatives is different. And then you kind of step out of your house, and then you're like, oh, there's another set of rules that I need to abide by, right? Like you're not going to like reach out and kiss somebody on the cheek twice that you just met, because that might be a little odd, right? And it's constantly like keeping the rules in your head that like feels stressful. Or you go to school with your ethnic lunch and you open it up and everybody can smell it, and like people just perceiving you a different way because you're not doing the thing that everybody else does. And it was really helpful, Natalie, for me to have this conversation with you a few years ago, where it was almost like being given permission to feel the feelings I was feeling, that I knew these feelings were there all the time, but I just didn't like have a word for it. And I
Yeah.
thought it was just something I had to deal with because I chose to come here. It's not like I was forced to come here. And it's kind of like, here's the burden that you just sort of have to carry, and it's going to be difficult. And I feel like this is not something I'm ever going to like resolve in my mind, in my heart,
Yeah.
right? It feels unresolvable. So, talking to you and learning that there's a way through racial trauma and stress was really helpful because I think it would help unburden my immune system, right?
Yeah.
And my psyche and the anxiety that goes along with it.
Yeah.
So,
I do
um,
want to say one thing. Sorry, 'cause you
yeah,
knew this was going to happen, right? Where I was just going to
of
be
course.
like, but like, I think part of the healing, is knowing that it's not going to be resolved, right? Like, and what I mean by that is like there's a level. I had a manager who said this to me one time, that acceptance is the answer to all my problems. And so if I can accept that it's not necessarily going to be resolved to like completion, right? But I can move from a place of, okay, what does that mean, if this isn't going to be resolved, right? How do I move through that? How do I work with that, Anyways, we'll talk more about
Yeah.
that.
So, because we're talking about the impact of racial trauma and stress on our own physical and mental health, can we talk a little bit about how racial trauma manifests in the healthcare system
Oh,
so
mhm.
that people can start seeing it, identifying it, and then working through it? Can you give us a couple of examples?
Well, there's a long history, as we know, of racial trauma within the medical care system, and especially in regards to Black folks, right? Where we have been used for experimentation without our knowledge, without consent, where um, there are it's implicit bias that impacts us as well, right? And that implicit bias comes from, this again, the history of the being passed down of things, even though we know that Black people are human. Okay, we know that now, but there was a time in our country where we were not considered human. We were considered three-fifths of a man. It's in our Constitution. And so, along with that comes all of the thoughts that Black folks don't experience pain
Yeah.
like others do. Um, then there's other types. This is again racial oppression, right? That um, that we might be med seeking, or that we're lying, or that there's because of again the dominant society having that piece of racial oppression, which is the power to define for others their experience that they're having. And so that kind of trickles down to everyday interactions that folks might have. Like, well, let's see. I know for myself, I'll always use myself because I don't want to, talk about my clients. But my experiences of like going to the doctor when I had my son, And he actually had eczema, a type of eczema called, I think it's called papular eczema, PAP. Is that how I say it, Dr. Payrovi? Uh,
Popular. Yeah.
yes, thank you. And I took him to the doctor. He was very itchy, had all these little itty bitty bumps. He was 2. They said he had mites and he was misdiagnosed. And they
Mhm.
gave him this medication that's supposed to kill, mites are like little like parasites. And so they gave him this medication that I was supposed to put on him that was supposed to kill these mites, but it wasn't that. Can you imagine what that medication did for eczema? It inflamed it, it made it so much worse. And I'll never forget how I felt as a mother when my baby was 2 and saying, Mommy, I'm itchy, and like not being able to like soothe him and calm him and take him to the doctor the next day. And the reason why he was misdiagnosed is that he wasn't seen by his regular physician, who was a Black woman. I always make sure that my physicians, that my care team is Black.
Mhm.
I don't care how long I have to wait to get in. I'm going to make sure that my care team is of the same ethnicity because of the fact that I've had experiences of being misdiagnosed
Yep.
or, and so when she saw my skin, she's like, no, this is eczema. This is not, who said that? And I was like, the woman who filled in for you yesterday. And so it's these experiences that we have, right? Where folks might be trained on different types of skin types and educated from like again a white point of view, but not about like what does that look like on Black skin, on darker skin, you know? Um, and so that trickles down, right? So now I have an experience where mm, I'm not trustful of just because, and then a lot of times we come from this thought that if the person is a doctor, then that we can trust what they say. But that is not my experience at all.
That's how mistrust develops for good
Yeah.
reason.
Yes. And again, so that hypervigilance, going back to that trauma symptom, right? Hypervigilance, hyperawareness, always of my ethnicity and the fact that there could be prejudice, discrimination, there could be that they just don't know about me, um, is there. So now when I go to the doctor, I'm always kind of like, yes, I am very much like listening to what they say, but I will also call my friend, Dr. Akua Prieto Brown and say, who's the physician, like, girl, they said blah, 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 blah. Is that true? Like, there's always a double checking for me. So that's how my racial trauma plays out in the medical care system. But there's lots of other ways, right? I think like if I were a patient who had MS, it might look like it's harder for me to one, identify my symptoms and trust that my symptoms are symptoms because I've been told when I go to the doctor and I'm complaining about things or I'm talking about things that it might be easily dismissed. It might not so it might be harder for me to go to the doctor because I'm like, I don't know if they're even going to believe me.
Absolutely. I mean, most people with multiple sclerosis are white, but Blacks are not that far behind. But we certainly don't see the same representation in research and in drug development. Their participation is clearly not the same. And so the therapies are not tailored to people of color. And part of that is the mistrust of research and not wanting to participate, right? Because of all the history
Oh,
behind
yes.
us.
Mhm.
Yeah,
Hard for us to be in clinical trials, right? Because we're like,
absolutely.
wait a minute, what is
Yeah,
that? What are you doing? Mhm.
yeah. And your story about your son reminds me of me. I was listening to a lecture like maybe 3 years ago given by a Black dermatologist who was teaching how to examine someone of darker skin so you do not miss anemia or cyanosis, which is lack of oxygen or blood flow. And I never once learned that in my medical training. And would that have been important for an anesthesiologist to know that? Like now I think about how many times did I miss something important,
Mhm.
right?
Mhm.
And It's not that I didn't care. It wasn't taught to me. It was not deemed to be important enough to bring it into the curriculum. And it was only 3 years ago that this even came on my radar.
Mm.
So we
Been
have to start,
practicing for how long?
yeah, we won't talk about that.
Okay, okay,
But
all right.
yeah, like 20 years, I've been in practice.
Hmm.
And look, I mean, we have to start thinking more holistically and bringing everybody in because it is important. Um, so for sure, misdiagnoses can happen when your skin looks something other than white. Um, Talking about our implicit bias and how we perceive patients and their symptoms, there was a patient that I will never forget. It's one of the most traumatic things I have experienced in my medical career. I was an intern. It was in the middle of the night, and a Black patient, maybe around 60 years old, started complaining of abdominal pain. He was there for something else, did have a history of drug use, but not active drug use. And he's experiencing just the most severe abdominal pain. And I'm calling my resident, I'm calling my attending, I'm talking to the nurse, I'm calling the on-call people, and nobody seems alarmed. And here I am looking at the patient, I'm going, he's really sick. And of course, people say, well, just give him some pain medicine and see how it goes in a few hours. It got so bad that I just didn't know what else to do. I got a wheelchair. Now imagine this is a patient that's admitted to the hospital. I put him in a wheelchair and I took him down to the emergency room where I was like, there are doctors down there who know what to do, right? They're not trainees. So let me just take him down to the emergency room to see if somebody will help him. And before we could even transfer him to the gurney, he actually died. He had perforated his bowel, and nobody understood the urgency of that. I didn't understand what was happening. I was an intern and we all missed it. And he died. And it was not drug withdrawal and he was not medication seeking.
Right. Oh my God.
Tragic. Like that he didn't need to die. He needed to go to emergency surgery. So this is how errors are made
Yeah.
because we don't take people's symptoms seriously, right? And
Um,
one of the best things I've learned as a doctor is just always believe your patient. Just
yeah.
believe them. If they
Yeah.
are complaining of something, believe them and then follow them. And you'll start seeing patterns if they are lying, but most people aren't lying.
Right. Right. Oh, that makes me so sad. It makes me so sad because knowing that that man died in agony,
Yeah.
right? And that you were trying to get help. And that is an experience that happens so often for Black folks. I think Serena Williams just talked about like the birth of her daughter and it's her second daughter and having experiences with I mean, this is Serena Williams, okay? I mean, she's famous,
Yeah.
and also the epitome of health, you know, and she was ignored. Her symptoms were ignored, during the birth of her daughter. It just, it's disappointing. And so when we talk about racial trauma, again, the constant exposure to ever-present race-related chronic stress, all of these experiences around racial oppression is always with us. Yeah.
Yeah. I think labor and delivery is really a very fragile place where
Mhm.
different races, I think, get different treatment. And that is largely due to lack of education by the healthcare team.
Mhm. Mhm.
And I can tell you, I went in for my C-section. I ended up at another hospital because I was nowhere near the hospital I was supposed to be at. And I do remember because of the way I look, I think this person perceived me as a person of color. And even though I was in agony of labor, kept asking me what my insurance was and kept asking me, do you have Medicaid? And I said, no, I actually have two forms of insurance. And she kept asking, this is the nurse like mistrusting me for how I look as a person who looks like an immigrant or, doesn't look like maybe completely white.
Mhm.
She was interested in making sure I could pay for my hospital stay. And no matter how many times I told her and showed her my two forms of insurance, she kept asking.
Yeah.
Frustrating, frustrating. But, change is happening. You just told me about a really great
Oh,
story.
I did. I did. Mm. So, it's hard to move on. Just like there's so many things that I wanted to comment on. Like one, the discrimination that happens against like drug addicts, right? Within the medical care system. And then also like, who cares if you had Medicaid? Like, does that mean that you still can't
Yeah.
be seen, you know? So anyways, no, recently, because it's Black History Month, there's lots of stories that have been on the news, the local news, KTVU, which is like one of my favorite local news, did a story on Alta Bates Maternal Health Department here in Berkeley. And they were talking about the disparity between actually, rates of death Black mothers during like giving birth in comparison to, white mothers. And they have been going through active training on implicit bias for years now. And the chief of the department was being interviewed, and she said because she believes that because of the trainings that they've had around implicit bias, that her staff is more attuned now to Black patients, and they've not had a single death in maternal, health for 4 years now. And what is the common denominators? That's when they started doing their trainings.
Education is power.
It really is super
Yeah.
duper important, right? Just for someone to be aware that, okay, wait, I might be thinking about this differently because of the fact that this, that, and this is informing, my thoughts, right? Um, and to be willing to think of it in a broader sense.
Yeah. So, Katie, you are highly involved in helping others improve their health through different means, through your podcast, your support groups, your mental fitness coaching. Tell me how this applies to the work that you do, this racial trauma that we see, and how people may access these programs.
Well, to be very, very honest, the people who do are not very diverse in nature, despite my efforts to kind of cast a wide net or to intentionally try to seek out more diversity. There is a lack of trust for darn good reasons, like we just shared. And, as a white woman who walks through this world with that privilege, living with an incurable progressive disease is really difficult. But if you're going to add on these additional layers like we've been talking about, and then the fact that people aren't getting the support that they could get from peers, right? It's just a travesty, and it has to change. And one of the ways I think that changes is for us, being trauma informed. There's wonderful programs, trauma informed care through ACEs. That anyone can go to. I went to them as a layperson, and I would hope that over time every medical professional is trained in trauma informed care, because trauma informed care and racially trauma informed care, these two things have to happen in order for these patterns to change. And until everyone has the same sort of access to support, it's going to be more difficult for certain people to navigate certain diseases. So it's something I care deeply about. I don't have all the answers, but I certainly try to educate myself to make sure that the places and spaces that I do offer are inclusive. And, we've made gains in the last couple of years, but I know there are people out there suffering in isolation.
Mhm. I
Yes.
love sorry. I love that you named trauma-informed care and then racially trauma-informed care, which does not exist. Right? It doesn't exist. Not formally is what I'm saying, like for instance, again with the DSM Diagnostic Statistical Manual, I don't know how long we've been fighting to get racial trauma in the DSM. I mean, and it mind blowing that it is not, because that's what so many people are experiencing.
Yeah.
It's
And
another
I will
barrier.
say in California, the woman who is leading the efforts is a Black woman. And I think that's actually why there is some positive movement, at least here in California where we are. But again, how long is that going to take? I'm so grateful that you shared, one success story, but how many other places aren't at all trauma informed or racially trauma informed?
Yeah. Yeah.
And why this matters is, we've now defined what racial trauma, what racial stress is. We've talked about how it can manifest in the healthcare system and how people access services. But let's talk a little bit about how it actually manifests on a person's nervous system and other related organ systems. So stress, whether it's emotional, physical, it's not just an idea in your head. It is translated to the release of hormones like cortisol, neurotransmitters like adrenaline, noradrenaline, um, immune system communication molecules like cytokines. And the job of these molecules is to get the body revved up and ready to fight the danger signal that came in. And that danger signal might just be the stress around racism or one's race, right? That somebody is experiencing every single day. There's a stress signal coming in every single day. So the immune system, the nervous system are activated and ready to act. Think about what that does over the course of months, years, decades, or a lifetime to someone's immune system. And so are we surprised that people of color experience more chronic health conditions, including inflammation, autoimmunity, cardiometabolic disease, mental health issues?
Hypertension, just that alone. I mean, that's a direct, I can see that from like chronic stress as well.
Absolutely. So there's real effects. And again, if we're taking a root cause approach, we got to talk about these difficult ideas that hopefully we now have permission to say out loud and talk about, even if it feels uncomfortable. So let's maybe start talking about some solutions. How can you recover from racial trauma, racial stress? Like, what are things we can do to start turning the tides a different way?
Yeah. Well, yes, I love talking about the solution because, we always talk about the problem. We definitely have to talk about the solution. I just want to say, like, this piece that you said that sticks with me, right? Which is like the chronic stress, right? And one of the wounds, invisible wounds of racial oppression that Dr. Kenneth Hardy talks about in his book is called the orientation towards survival. And what that is like a lovely term that is like capturing that, like the chronic stress. Like if I'm constantly under this guise, right, of like, it's not safe. It is not safe for me in the world. So my guise is always towards survival. That is a type of stress that is like with me all the time, right? Wherever I go, like just a tense feeling of what used to be called paranoia, right? And paranoia has like a very negative term, but I don't know if it's like protective paranoia, right? Or protective, like I have to think this way. I have to think about, um, you know, uh, that when I walk through a store, like, where to put my hands or like, because I don't want to be accused of and blah, 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 right? Um, and then I just thought of Trayvon Martin, right? It's like the things that happened after that young man was shot was that Black children were told like don't wear hoods, don't put a hoodie over. Um, so I just thought I'd say all of that because it's so important to think about what racial trauma looks like in everyday action, right? Um, and I worked at plenty of clinics. I had one particular place that said that, the director of the program said, when we would do these talks, these trainings, right, diversity trainings, or try to get diversity and inclusion and, trainings, they really were like, well, how does that impact patient care? Like they didn't see how it impacted patient care. And it's like, we want to make this a safe space for people to talk about or to be able to come forth with what is happening for them. So, how do we work through racial trauma? I think some of it is like, how do we make a safe space for it, right? A safe space to talk about it, to normalize talking about it like we are today. I love, you're like, now we have like some of the verbiage, the language, right? And again, like within my own community, we've always had like this language around it, but it was more so again from like how to protect ourselves, right? Not necessarily, yes, I think around healing, but it was for us, right? And so now I think what is really wonderful, and I'm attributing this also to the Black Lives Matter movement, is that collectively we have to do this. Um, and when I say do this, I mean collectively we have to have these conversations and then think about what we could put into place. So one of the things that I talk about a lot is radical self-care. When I work with um, Black and Indigenous people of color, I talk about radical self-care. And they're like, what is that? Well, it's the assumption that you take care of yourself before anybody else. Why would that be radical, for a person of color? Well, I mean, let's just go back to the history of my people, right? Being from, you know, enslaved Africans, that was not a premise to take care of yourself. You need to take care of Massa's children, Massa's land. And if there's anything left, then maybe you can take care of yourself and your children. So the trickle down effect is on an unconscious level, there's like, oh, I'm not allowed to take care of myself. I'm not allowed to rest because we have internalized messages from stereotypes that we're lazy. And when I say rest, what makes that radical is like, actually taking your PTO, actually taking, time to, rest your body and your mind, spiritual practice with meditation. I don't know, but like discovering what that looks like in terms of rest. But radical self-care also means that, like, if I'm going to be what I tell people to be little Malcolm X's about their self-care, which is by any means necessary, that means that I'm going to look at every facet of my life and how can I put myself first? I'm going to set healthy boundaries in my relationships, even with family members. Lord have mercy, right? I'm going to, you know, um, and those healthy boundaries also means like at work, you know, I'm going to know when you know, it's okay for me to speak up, when it's a safe environment for me to speak up. And if it's not a safe environment, it's okay for me not to, because sometimes that plays in our head too. Like, oh, I didn't say anything. And it's like, wait, was it safe? And so some of our radical self-care too is like, how do I evaluate what's a safe space for me? I'm going to get therapy.
Mhm.
I am going to, and if therapy is not my thing, I'm going to talk to, my pastor about it. I'm going to work within what I have to help me process this. Um, I'm no longer going to be voiceless. And that is also a consequence of racial oppression and racial trauma is this learned voicelessness because we were told that our voice didn't matter. So it's a reclaiming of things. So underneath this umbrella of radical self-care is so many different things, right? I am going to go to the doctor. I am going to take care of myself and get my checkups and do what I need to do and advocate for myself. That's a form of radical self-care. Um, I'm going to exercise. I'm going to, you know, um, experience things like I did yesterday, which is really part of my radical self-care, which is go to the Black Joy Parade, in Oakland that they have once a year. I'm going to surround myself. This is part of my radical self-care. I surround myself with people that are like-minded.
Mhm.
What? Yeah, I don't have to hang out with or let people into my circle that doesn't share similar views to me. And a lot of times we do think like, oh, I need to like, no, if it's offensive or if somebody's been offensive to me, it's okay for me to like, okay, I need to have a bubble around myself. Um, I have a really great bubble in my community, my support, you know. So I think radical self-care looks like a lot of different things, but these are just a couple of things, you know. It's okay for me to take up space as well, you know.
What can we do when others don't acknowledge our need for self-care or time to rest?
Mm. You mean like others meaning like
Whether it's
or
family, people around you, or even work, you
mm,
know?
yeah. Um, that is that part of, especially with like, you know, in our relationships. So I'll back up. One of the things that we know about racial trauma is that it impacts us on so many different levels. One of them is relationally. You know, how do I relate to others? How we relate to each other within our own ethnicity, right? And so what do I do if people don't honor my self-care, don't honor, you know, then I give myself permission to, one, I don't have to argue with people about it. I don't have to prove to people anymore that what I'm experiencing is racist. Like I spent a lot of time throughout my academic career trying to educate people on racism. My radical self-care is that I don't do that. I've devoted my practice to working with, you know, Black and Indigenous people of color around healing racial trauma. I used to think that I couldn't do that. And so when I tell people that my practice is just for, you know, Black and brown folks, they're like, what? I'm like, well, yes, of course, I see other people too, but my specialty is around working with Black and brown folks around their healing. And so I don't need to justify that to anyone. It just is.
I love that. Like, you don't have to explain it. Your truth is your truth, and that is what it is without you having to justify it. You're,
Absolutely. And that's part of healing racial trauma is really reorienting us and reconnecting ourselves to the truth of who we are because racism has separated us from the truth of who I am, right? It's told me that I'll just tell you all the things that I've been told that one, that I'm hyper masculine. Oh my God, you know, just because I'm like, you know, 5'10" and you know, dark skin, you know. Um, you know, so like I don't have to like pay attention to that anymore. Or I've healed that, right? And so there's all the different messages that I have internalized that I've also had to work through. And it's a practice. So when you said like it's going to be resolved, I tell myself that like because sometimes these messages come back up, right? And I tell myself like that's part of it. That it's not like it goes away, but I have a different set of tools to work with it now. Now I recognize it sooner and I start my practices, right? You know, or I sit with the like, oh my gosh, this is painful. This hurts. I'm not going to run away from the pain of racism. I'm going to sit with it. And I'm also going to tell myself and challenge those thoughts and with more realistic and reality-based thinking, you know?
I just think it's beautiful that we can actually talk about these things now. Back when we were kids, this was not a thing. And I think about your 13-year-old,
Mhm.
how you might be teaching him and educating him this so he doesn't have to undo a lifetime of maladaptive strategies, hopefully.
Hopefully, you know, I mean, I purposefully chose to send my child to an all Black African centered school here in Oakland called Ile Omide. I love Ile Omide. They're amazing for us. And he went to that school from ages 3 to 11 because I wanted him to have a different experience. I wanted him to be grounded in the truth of who he was, um, and not to have to constantly fight these messages, you know, that I had to. And that's been great. And so now he's in public school and one thing that my son knows is like he knows who he is as a Black person. He knows who he is as a Black man, and but we are constantly having these conversations too, you know.
Yeah,
I hope that makes sense, all the things that I just said.
it does.
Mm-hmm.
So, Katie, I want to turn the conversation over to you as the white person on our panel of three. As someone who is white, you do experience privilege in some areas. Certainly not, no one has privilege in every area, but what does radical self-care look like for someone who comes from privilege?
Yeah, that's interesting. I mean, I think it's different for everyone because it has to do with so many unique aspects of our identity. Um, but it is accepting all of the things that Dr. Pearson just mentioned, right? And the racial implications of those as well. And then for me, a huge part of my own learning or unlearning has been really understanding how toxic white supremacy culture is for all of us and the responsibility that all of us share in dismantling that. And let's face it, the system was created by people who look like me to benefit people who look like me. And so deepening my understanding of that has helped me learn ways that I can dismantle that in my own life. So, for example, if I'm working somewhere, and I've already shared that some of my values are diversity, equity, and inclusion, if I'm working somewhere and those values aren't shared, just like Dr. Natalie says, like I have the ability to walk away from that and realize that this doesn't feel, I mean, I've lived that experience and it didn't feel like a safe space for me to work because the things I saw in action were things that I knew were wrong. And I wish I had had the knowledge that I have today to walk away at the time. I certainly wouldn't go back and give any more of my time or expertise to certain places, right? But I think the more I learn, and really, I think for me, the doorway has been that othering that we talked about, right? Leaning into the ways I have felt unheard, listening to some of my very best friends are Black, listening to them and their lived experience, and really like understanding that what they're saying is true and not having to have a white person say it for them. That's something that happens frequently. And once you see that happening in front of you, it's really distasteful. So listening to people, believing their stories, right? And then we always talk about root cause medicine. Let's go to the root cause of all of this. And that is the white supremacy culture. And we live in it. It's almost like a fog. A lot of the experts in the area talk about it as a fog that sometimes it's hard, especially for people who look like me, who have white privilege, to see it. But the more we can learn about it, I mean, I always think education is the key. And if people are looking for resources, one of the best I've found, and it's actually a recent read, is Rest is Resistance, because this talks about grind culture, which is something that so many people who have autoimmunity and inflammation. I mean, that is kind of a root cause of that. So we understand that. And then understanding that underneath that grind culture is because we have capitalism and white supremacy culture landscape. So it's, for me, it's a lot of unlearning and also kind of owning things that people who look like me have done.
Mm-hmm. Mm-hmm.
I want to be part of a solution, not part of a continuing problem. Do I make missteps? Probably every day. Yeah. I try not to blame or shame myself, but I am dedicated to learning more and then doing better.
So I'd love for us to get a little more descriptive of what we mean when we say white supremacy culture. Every time I hear this term or I want to talk about it, like my heart rate goes up here because it's an uncomfortable topic for me to acknowledge, to
Mm-hmm.
name it, to call it out. So I think it would be great if we can break this down
Can
of
I
what
ask,
it is.
what makes it so uncomfortable for you?
Well, first of all, it's images that come into mind of skinheads and neo-Nazis and just scary images, right? Ku Klux Klan, let's say. But also acknowledging that it exists without wanting to blame people who just exist in it. Like, I don't want to blame, I want to find solutions, right? But we also have to acknowledge that this thing is something we are in every day. And I didn't have an idea of like how to describe it, but after talking, especially to Katie and you, I now understand it so much better. And I want to discuss it in a way that doesn't alienate people that are white, because this is something that's going to take everyone to start dismantling. If we truly want to be in a fair and equitable society where we use the lens of compassion and empathy rather than this is mine and there's not enough to go around and I don't want to share, right? Fighting for resources. I
Mhm.
mean, why do we have this in place anyways, right? It's to create a hierarchy so that the people in power can get more and the people down below have to learn to do with less. So I want people to understand what this is. So can we talk about that?
Do you want to talk about maybe some of the categories
Yeah,
within white supremacy culture?
sure.
I, based on what you just said, let's talk about the first one, right to comfort, right? There
Mm.
are certain people who tend to look like me who have more of a right to comfort. Sometimes, other people might feel intimidated to bring something up. I know I certainly do when I'm in a space with a white male who might not be thinking in an inclusive way. I may unfortunately choose to silence myself because I don't feel safe. But I'd love to hear from Dr. Pearson about right to comfort.
Well, I have to tell you, like, uh, I would, I'm not familiar with the term right to comfort, but I think I know what you're talking about, right? So I don't want to fill in any blanks with that. But I will say, like, white supremacy is the thought, the premise that, like, white dominant culture is, it's in the name, supreme, superior, and everything else falls underneath that. And so when we look at white supremacy, right, that means that and the reason why I think it's really hard for some folks to see it is because it just has always, at least in this country, on this soil, since, Christopher Columbus discovered it, right? Um, that has been the premise, right? That my culture, how I live life, how I do things, how I talk, my language is supreme. And you need to find a way to get in line, right? So if we're going with like racial oppression, we see that that's the power to define what is normal, what is not normal, what is accepted, what is not accepted. Um, the greater and differential access to resources, right? Um, the I think there's this piece around objectification of other ethnicities. That's that part about like, not being if you're not white, then there's parts of you that I like that because it's more like being like white folks than not like that objectification piece. We see this all the time right now with Black bodies, right? Um, the BBLs and lip injections and the things. There's parts of Black folks that people really like, but they don't necessarily want to have the experience of being a Black person, right? You
What's a
like,
BBL?
oh, Brazilian butt lifts. When at one point in history, it was, we talk about Venus Hottentot, who was a woman, an enslaved African who was paraded around the world for her ass, but not in the way that like we're talking about today. It was like almost as if she was like, mm, part of like a circus act or something, you know. Um, I think white supremacy is in like our penal system and punishment, like, right? And also around silencing, like whose voice gets to like, speak about things and determine whether or not that is right or wrong or whatever, and that all comes through the lens of white culture, you know. I am And then there's stuff that happens that like gets taken on where it's not so like overt, right? It might be more covert, right? Um, and so that's where I talk about like the internalization of the toxic messages, right? But um, it's interwoven into everything where we live, where we, you know, um, you know, play, all of that, you know.
It is. It's in definitions of success, right? And how we look at performance, right? And it's a lot of process over people, is the term that I've heard, which is, caring about analytics, caring about the numbers, but not like the holistic person. It's the care that's missing in lots of healthcare, right? There's so many issues in education as well. And so yeah, it's these invisible structures and systems that you only really feel if it negatively impacts you, right? And so opening our eyes and having these conversations is the only way we can dismantle these systems.
What you just said reminded me of like, the area of medicine that I practice is sort of like less amenable to the scientific method. It's extremely hard to do giant studies on the impact of nutrition on a specific disease or outcome. But anything that falls outside of the scientific method, we just kind of poo-poo and say, oh, it's probably just the placebo effect.
Uh-huh.
I actually was so mad. I made an Instagram video about this where I was giving a talk to a group of doctors. I was talking about the importance of identifying food sensitivities and removing them from the diet. And he, started talking about, well, what's the evidence? What's the data? How do we know that this really helps? I don't really care about how people feel. I want to know the data.
Mm,
My brain just stopped working because I care a lot about how people feel. Yes, data is important, but it's not everything because observation is important. Your experience as a practitioner is important. And we forget about all that and we just want to stick to the data. So I'm not saying that I'm against that, but I'm just saying, like, let's be more holistic and do the common sense thing that
right,
helps people.
right.
So yeah, absolutely. That wanting to stick to the numbers and the analytics is, I can see that being part of white
Mhm.
supremacy culture for sure.
And the data is never normed on me. It's never normed on Black people, you know, or brown people, or like so many studies, that's why when there's statistics, when there's, data and things like that, I need to know who's your sample population, like for real,
Yeah.
and I think like, you know, in a lot of cultures of, color, there's a collective sense. We're thinking about like this is a common saying, like, a village raises, it takes a village to raise a child. Well, the reason why we say that is because, our structure of family was kind of like destroyed. And so it was the village. It was, everyone coming together because, who knows whether or not, your husband, your child, your mother, your father, your brother, your uncle is going to be sold, or lynched during like after slavery, with Jim Crow and so forth. And so, or even today, the modern day lynching, right? So we there's a collective sense. That is not a white supremacist view. It's very individualistic. When COVID happened, one of my girlfriends who lives in Rwanda came, and she comes back and forth a lot, and she's like, "What is this with you guys with masks?" She's like, "We don't have that issue. Like, put a
What was the issue?
mask, wearing a mask, the PPE, you know,
Uh-huh.
And she's like, we don't have that issue in Rwanda. Like we just got out of like genocide, like, what, 30, 40 years ago. Like we care about our young and our old. Like everybody has a mask on. Nobody's questioning it because we care about the collective, right? And so we see that individualistic versus collective. That also is like a white supremacist view too. Um, yeah.
That one's huge. And I'm wondering, Dr. Payrovi, if you could share kind of what you've learned and put into practice with group healthcare, right? And forming these communities of care where people are working together. And from my experience as a participant, it accelerated my health. So like that community is actually how we heal. And so this white supremacy culture, individualism, is preventing us all from healing. Can you share a little bit about that experience?
Absolutely. I mean, community is medicine. So when I have sort of transitioned my practice from seeing patients individually at Stanford to doing shared medical visits, it's unquestionable that people's progress towards improving their health is accelerated. Like you
Mm,
can't deny it. It is by far the best way to practice this type of medicine. However, it's a new way of practicing medicine, and there's a lot of hurdles I have to jump over to be able to provide this care and to be able to get insurance companies to agree to pay for it. But I'm hoping that the tides will turn, and I'm collecting data to be able to show that a person who attends shared medical visits where we help each other make change in our daily routines and habits, that this is real medicine and that we should care about it as an insurance company if you truly want to have a healthier population, right?
mm,
And I can tell you, like when I first got diagnosed with MS, I was, I really didn't tell a lot of people for at least a few years, and I was sort of struggling on my own. But it wasn't until I was more public about it and I had a few people I could talk to that like things accelerated, that I could depend on other people. So our individualistic society, I think, is a hindrance to healing, really. So I love
mm.
all the examples that you all provided. And if we can dismantle white supremacy culture, it can help everybody,
Yeah. Yeah.
white, black, colored, whatever, everybody. Um, so I think it's important that we all listen to this conversations like this with an open heart and open mind and start thinking about our interrelatedness.
Mhm.
Just like our ecosystem is one system, the human body isn't separate organs, it's one system. Our communities, that's also an ecosystem, right? And we all rely on each other. So I want to move towards a world where we care more for each other.
Absolutely. There's so much to what you said with, you talking more about your diagnosis, right? And how once you started talking with other people about it and getting more support, I'm sure it did this thing like that decreased your sense of isolation,
Mhm.
you know? And when we feel isolated in our experience, it's like, I'm the only one who's going through this. I'm the only one who, there's a shame to it. There's a, you know, even though there's nothing shameful about it, but for some reason we have kept this secret. And it's when we're with other people that have experienced similar things that we're like, oh my God, I'm not the only one. You too? And then like, oh, how did you get through that? How can we get through this together? And that is a lot of also that part of like when I talk about radical self-care and like creating your bubble, your community of support, your people. Who are your people? you know, um, Dismantling white supremacy in its various many forms means that if we're going to take something away, right, which is this ideology, right, then we have to replace it with something else. And I think it's the taking away that folks who are clinging on to white supremacist views, like in terms of like critical race theory, where people are like, I don't want that book. I don't want my kids learning about racism or in the transatlantic slave trade or what happened on this land, right? That poses a threat to them. And it's like you really can't move forward if you don't know your past, because it'll happen again. And what we're saying is like, let's one, stop lying to ourselves and move from this place of acceptance so that we can heal. We stay sick when we're in denial. I mean, that's the major thing about psychology, right? What is the biggest defenses that we have psychologically? It's denial, but that just keeps us sick.
I love that. We stay sick when we stay in denial.
Absolutely. And then the other one that you liked, that self-care is more than a bubble bath.
I was going to do a quote on this with your picture on my Instagram.
I
I'm
know.
going to do it. Right? That's what people think of. Like, oh, I can't afford a massage. I'm like, that's not what I'm talking about.
Yeah.
Self-care is it's so much more simple and more accessible if we are just willing to use it, make
Yes.
space for it.
I still want you to get the massage too, because that's fun and that's good. But if you don't have money for that, like there's other ways too that you can care for yourself. And
I think of yoga as like self-massage,
mhm,
right? Turn on a yoga video and go for it.
yeah,
So
validating yourself too. That's another form of self-care.
say that again.
Validating
Oh,
yourself, right? Becoming internally validated, not relying on something outside of ourselves to tell me that I'm worth it. I know intrinsically that I'm worth it, and now I've had to work really hard for that, but that's part of the work, like that. So when I say I'm worth it, I'm worth going for my dream job. I'm worth doing, being in a relationship where, I'm seen and I'm appreciated and I'm valued, as opposed to staying in this, I'm just giving examples, domestic violence relationship or relationship in which I'm being dismissed at work or whatever. Like I'm worth more, and that has to come from inside.
And the same is true from a white ally perspective. When I really got into understanding what metaphysical experts believe as the root cause of multiple sclerosis, it's a betrayal of self. And I had to really examine areas in my life where I was not living according to my values, right? And the closer I get better at being values-based leadership for myself in my own life, I've started healing. And so I think that this is really important. What you are saying is doing this deep self-analysis, but whatever our background identity may be, and then moving from that place to dismantling these harmful structures.
Mm-hmm. Mm-hmm.
and Katie, I want to make sure your perspective is being heard so that people have a clear understanding of how all these different concepts work together. I mean, we've talked about white supremacist culture, and white guilt comes up a lot. And I don't want to leave this conversation without exploring that as well. And as the white person here, could you speak to that and help us understand what that feels like for a person like you?
Sure. It can feel pretty crappy. I hate the idea that people who look like me and even myself with my best intentions continue to not make this country a very inclusive place. Now, I could choose to try to ignore those feelings or deny those feelings. But I do believe that the only way around is through. And so, and especially, since I shared, like I've experienced how opening myself up to learning about this has helped me on my own journey. So if it's going to help me and it's going to help everybody, why wouldn't I do this? So it starts, I think, with what we talked about those commonalities. Like, let's learn some empathy across lines of difference. Let's learn to trust across lines of difference. And, I can choose to stay the way I am, or I can try to turn that anguish into positive action. And that's what I've chosen to do. I'm trying my best. I am also open to feedback from my friends. We engage in these conversations on the regular. They're still not comfortable, but they're important. So,
Mhm.
you know, I think like let's acknowledge that this is a thing, first of all. And if there are people listening who still aren't sure, I encourage outreach. I'm happy to meet with people and go through some of the materials that have helped me develop my own awareness. And I'm also happy to share with people my annual goals that I create around dismantling white supremacy culture. That's actually something I do every single year and reflect on ways that I'm perpetuating the problem. So I don't know what else, but I'm an open book if you have any other specific questions, but I'm trying my best to increase my awareness and again, just be part of the solution rather than part of the problem.
It's so beautiful how you show up even when it's uncomfortable. And Natalie, I've learned so much from you. We didn't have contact with each other for a long time, kind of between college and, recently, but it's so wonderful to see you as a person who has taken on a very difficult area of practice
Mm,
and that you're doing the good work to help people take better care of themselves. So when we talk about solutions, you've
mhm,
talked about radical self-care and we've defined what that is. What else can we be doing as actionable steps to help
mhm,
ourselves, to help our communities, to
mm.
help being make this world a better place?
I have all the answers. Just kidding. Not one. But I think like what we're doing right now. I love what Katie said about like about white guilt. Like it's not going to feel good. I think the same applies to some things with radical self-care. Setting healthy boundaries in your relationships with people is not going to feel good. Sometimes they're not going to like it and they're going to push back and it's going to feel uncomfortable. I think taking those first steps around radical self-care, like really sitting with the fact that, oh my gosh, I haven't done these things because I actually didn't feel worthy of it. That feels uncomfortable. And so the willingness to be with that feeling and then still continue to do the next right thing. I use a lot of recovery principles and sayings because I worked for 8 years with addicts. And I just think that it was just great life skills, right? And so one of those things is like do the next right thing, and that means like if that means advocating for people that you see are voiceless, that's the next right thing, and it requires it requires sitting in the muck for a minute. The shit is mucky.
Mhm.
Racism is awful. It is painful. It is evil. I mean, in the true sense of the word. And like the only way to heal that is to look at the atrocities, to look at what we've done and say, I'm not going to do that anymore. And I'm not going to participate in performative ways of saying that I'm doing the work and I'm not. And be uncomfortable. So there's a little bit of like knowing that and then continuing to do the next right thing, right? And that might look like um I don't know, so many things. I'm thinking about school boards. I'm thinking about like what's happening right now in education, Katie, you know way more than I do. What's happening right now on education and critical race theory and trying to eliminate our history, right? And might be like advocating for that. I know like for me and my people, what it makes sense for us is like just being able to get the care that we need. And I mean like therapeutically. I do believe that our healing around racial trauma requires a psychological perspective. It requires to work with somebody around sitting with the pain of it, Trauma fragments our sense of self. Any trauma fragments our sense of self. But in particular, racial trauma does around, and to be able to like start to put the pieces back together, to change the narrative, right? That we've internalized. You get to create your own narrative. And just by nature of you creating your own narrative, like that is so healing as opposed to somebody else telling you what you deserve, what's available to you, what you can do and what you can't do. What's possible for you. You get to change that. I do this work because I don't think I really thought I had any other like
Mhm.
it just is. It just always has been.
And this is why working with a therapist is so important. It accelerates that process. You
Why
can
it does.
spend a lifetime trying to figure it out on your own, don't you think?
Yeah, and you don't need to, and I think the work that I do around racial trauma, when people come to me, lots of times people come to me and they'll be like, oh, I have issues with depression or anxiety. And when I work with folks of color, it usually always comes down to some type of racial trauma. But we didn't have a language around it. We didn't have and that's why, I keep saying Dr. Hardy, but, the book says we're healing invisible wounds because racism causes, the internalized part of it. It seems to be like it's invisible. Like nobody else experiences it but the person. And it's like, no, we've all had this. In particular, I'm talking about Black and brown folks and how that we can come together and work with somebody around racial trauma, around, you know, acknowledging what is. And again, these are like catchphrases, but they're so true. It's like reconnecting yourself to the truth of who you are.
I love that. It's important work that I think we all owe to ourselves to do if we really want to live a whole life where we're not constantly being thrown around by forces of racism and all the other things we're exposed to.
Yeah, absolutely.
Yeah. And I've been seeing a lot of changes in how the norm is being shaped. I was actually just curious before our call today. I was like, let me look up some pharmaceutical companies. I'm curious about what kind of faces they have on their websites. And I'm seeing inclusion of a lot of other, people of color,
Mm-hmm.
which is
Mm-hmm.
helpful.
Mm-hmm.
Though when I'm always looking up stock images, to put into different things, everybody's white. It's very hard to come across images of non-white people in stock photos that you could use in, blogs and websites and things. So,
Right.
it's starting to change. You're seeing models that look different. Um, just the
All
fact
I
that
had was Naomi Campbell.
was that
I said all I had was Naomi Campbell.
right?
I'm happy to have her. I mean, I still love her. I put her on her pedestal, but.
Yeah.
My hope is that things will look different and they will also feel and operate
Absolutely.
different, right? And so, I'm really leery of advertising because, it can look like one thing. Oh, we're doing this so we have a better public, people have a different public view of us. But are the operating principles that
Mhm.
support the organization, have they changed? So I may be a little more skeptical there since I've worked for organizations that champion equity and then within it's not equitable at all. So
Yeah.
yeah, I remain a skeptic, but a hopeful skeptic and just trying to do my part.
Yeah, staying optimistic, right? Like I really want to know in the clinical trials of the drugs of that pharmaceutical company, who did
Boom.
they include, right? This stuff
Mhm.
is deep. You can't just take the things that, at the surface level.
No.
It requires a lot of digging and asking questions, and critical thinking. So, but it's okay. It's the work we have to do to heal our society, right?
Yeah.
There's also a lot of books and resources that we're going to link to in the notes for those of you who want to learn more about how to navigate this. I've been talking about this for a while with you all and other people, and it still feels really hard for me.
Oh, it's gonna feel hard for a while. Like, oh yeah, girl, it's gonna
Dr.
feel
Pearson,
hard.
is it easier for you now, or is it still hard for you, for someone who does this work every
It is
day?
very hard. It has gotten easier for me to do these talks, but I'm not gonna lie, like it is uncomfortable. It is, I mean, I was, tossing and turning last night about having this talk. Like it's never, it's never easy. I always have in the back of my mind all of like the horrific experiences that I had in academia, right? So a lot of people have lots of memories of, about school and things that were awesome. Like I don't, my memories are connected. I can remember every single racist experience that I had in education. Like I said, from kindergarten all the way to graduate school. And so sometimes when I do these talks, like my mind goes to like somebody's gonna pop up and say this and question that, and I'm going to be put on like, and knowing how to navigate that, right, is something that's like my racial trauma, is being like really like hyper focused on like knowing all the possible answers and and I've recently like kind of like let go and just said like this morning, like it's enough. What I have to offer is enough, you
You
know.
are enough. Yeah.
Yeah. Um, and that I don't have to have like the perfect answer and this and that, but I don't think it ever gets easier. It's definitely not easier. This is just, I have really good tools in my toolbox. I've got a really great community. I have my people who I go to when I have hard days around this, because my lens is always through like racial oppression. Like that's how I see the world and that's how I experience the world. So, um, does it get easier? I don't know, but I definitely like feel like I have more tools around it. Um, yeah. Also, I'm happy to be a tool for somebody who wants to get therapy around racial trauma and you're living in the state of California. Um, but that is
Right.
something that has helped me too, is being able to work with people. I might not be able to do the work on a like a, you know, grand scale, like change society forever, but I can work with people on individual and group levels around, how to heal these pieces for themselves.
Yeah, well, you are a gem, and I highly recommend people to seek out anybody, you or someone like you, to do this work, right? Because I can't imagine that this is your lens because you're a psychologist. I think this is the lens of everyone who is Black, brown,
Uh,
the minority,
yeah, this is not my lens because I'm a psychologist.
right?
Absolutely not. No, no, no. Even when I
Yeah.
went to school, make no mistake about it, every single paper that I did, every single thing that I did was on Black folks. I brought that, not the school that I went to. Not,
Yeah.
it was a one-liner at the end of the semester for the diversity talk for each topic. Black people feel depression like this. Latino folks, feel depression like that. And so, like, if I wanted anything beyond that, again, that's the dominant culture trying, having the power to define and tell me what it is. Like, I had to bring it myself. And so
Yeah.
that lens that I'm talking about is the lens of like walking through this life as a Black woman. It's, yeah, it's vastly different. And so that's what I'm always looking at and thinking about.
Katie Sloan, any final words from you?
Just mostly grateful to be here in this shared space with you and to have this open conversation. It's also uncomfortable for me. But I also know that most of the things I've done in my life that have been the most important have also been hard. And
Yeah.
so I guess just, if listening to this conversation makes anyone uncomfortable, sit in that, marinate in that, think about why, and explore those aspects of identity that we talked about. I mean, again, the only way around is through, and there are three very different people here who are welcoming other people to reach out and connect. And I think each of us can try to do our part from our unique perspectives and try to be part of the solution together.
Yeah, absolutely.
Well, both of you have inspired me to learn, to do more, to think beyond what's just on the surface. I want to encourage myself and my children and people around me to, look at our differences and celebrate them and start thinking more like a community rather than just what's all about me and what's mine. That's not
Mm.
the world I want to leave behind for my kids. So I'm going to leave contact information for both of you down in the notes. I highly encourage people to reach out. Both of you are super approachable and easy to engage with. And I'd love to keep this conversation going. This really just has opened up my eyes and my heart to so many things that I didn't know I was allowed to think about or acknowledge. So, so grateful to both of you. Thank you for sharing this space with me today.
Awesome. Thank you so much for having me.
My pleasure.